April is Minority Health Month. The State Health Department has a full calendar of events, and we're about halfway through. Dr. Christina Box is the State Health Commissioner. Antoinette Holt leads the Office of Minority Health. We thank you both for joining us on what certainly is a busy day considering the month that we're in. For both of you, and Director Holt, we'll start with you, what are your hopes when you go into this month, and then give us sort of like a midterm progress report with where we are today?
It is our goal that people understand just the importance of the work that's going on to address the issues and concerns amongst underserved populations and communities. And so that's what Minority Health Month gives us that opportunity to do. It allows us to highlight not only the issues, but the people that are doing the great work to make differences in the lives of individuals all over the state.
Now, Dr. Box, how about you, and how this fits into the overall state health picture?
So it's really important, as Antoinette says, to take this month to highlight the important work that we have to do in decreasing those disparities in health outcomes and in health metrics in our most vulnerable populations, in our communities of Black and brown color. So we want to make sure that we are addressing that, and we do every day at the State Department of Health in all of our divisions, including Antoinette's division, and with our local community partners in public health across the state.
It feels like these days everything is viewed through a lens of COVID. You have a background in epidemiology. When you look at minority health as a general issue and the COVID pandemic in specific, have we learned things through this that are needs that maybe we either need to further emphasize or didn't know about before? And have there been opportunities out of this as well?
I think we've learned a lot during this pandemic. One, making sure that we have community leaders at the table when we're making the decisions and choices of what we're going to do in the communities, making sure that we address access and incorporating that within all that we do. So I know the state our Department of Health has taken great strides to try to make sure that we're incorporating equity in our processes and our planning and what we're going to do, how we address our communities and concerns, and then making sure that we do look at the numbers, because data does make the world go around. And so it's important to know that who we're not serving, how can we get to them, and that's, again, involving the community and the people that we partner with.
You know how this works as the boss. Department's head comes and say, hey, we'd like to do this, and you got, well, this will work, that won't work. Do you see opportunities that are actually actionable?
Very, very much so in all of our divisions and all of our areas, because there are so many poor health outcomes in our communities of color. And so working with our community partners who our communities of color tend to trust more, whether those are faith-based or individuals that are in their community centers, is really critical, as Antoinette mentioned.
There was a component of the NFL Alumni Association vaccine town hall that Gary Brackett was here on Daybreak talking about a few days ago. Participating in things like that, connections like that, have really only come because of the pandemic. So there are, I don't want to say benefits from it, but things we've been able to take opportunities in.
Absolutely. We are determined to take away all the positive things that we need to memorialize and continue to do. Our Deputy Health Commissioner, Pam Pontonis, was involved in that event. And really, it's a great time for us to be able to share the safety of vaccines and how they protect us from more severe illness and death with regards to COVID.
Dr. Box, Director Holt, thank you both for being with us today. Continue good luck with the rest of Minority Health Month. Maybe we'll check in with you at the end of it, get a progress report, full report card.
Thank you so much.
Health leaders here this